Okay, do you guys remember when I said that working at a level 1 hospital has its pros and cons because as a nurse, you really need to be on top of your game because you're working with residents that are still learning? Yeah, let's get into something that just happened. So my patient was having sustained tachycardia. Heart rate was in the 120s, nothing like crazy or emergent, but obviously like something is going on. Like this patient has been tachy for a little while now. And I go up and I let the doctor know, like, hey, my patient has sustained heart rate in the 120s. They are on metoprolol. They're only getting 12.5 milligrams. Maybe we could just, increase the dose. I think they just need a little bit more. And keep in mind at this point, my patient is experiencing some ICU delirium, which I have talked about. It just means they're delirious from their ICU stay. However, they're not agitated. They're definitely hallucinating, but they're a lot more drowsy than they had been before. And so the doctor's like, how about we give them a dose of Haldol and Seroquel? And I'm like, thinking, why the hell would we do that? The patient is not agitated. They're not restless. They're tachycardic. They're drowsy and tachycardic. And sedate for heart rate? I'm sorry, I've never heard that before. Because I know I would have made like a cute little jingle to remember that in nursing school. And doesn't exist. Again, if my patient was agitated or restless, this would be a different story, but they weren't. They were lethargic. So they tell me that and they put in the orders, and I, of course, first thing, ask my coworkers, hey, have you guys heard of giving Haldol for heart rate? Do they do that here? And the nurses are like, no, what? And as I'm asking people and my charge nurse, what do you guys think about this? I don't think this is right. I don't feel comfortable. The doctor is periodically coming back. Hey, did you give that? Did you give that? Did you give those meds yet? And then, after getting a general consensus that I was right, they do not do that, that is not right, I go up to the doctor and I'm like, hey, I personally do not feel comfortable giving these medications because the patient is more lethargic than before and, their behavior isn't an issue. This is about the heart rate. And they're like, well, I guess we could just give the Seroquel. I don't know. Their heart rate could just be high because they're having bad dreams. Huh? So then I'm talking to my coworkers. I'm like, this doctor is not budging. What am I supposed to do here? And they're like, okay, time to talk to the nurse manager. So I go to the nurse manager, I tell them the situation, and they're like, that's not right. Here, let me come out there. And then the nurse manager comes out and suggests metoprolol, and the doctor's like, oh, I didn't realize the patient was on metoprolol. I had no idea. That's a lie. I told you. And then whoop-de-doo, they ended up giving me 5 milligrams of metoprolol IV push, and the patient's heart rate went under 99.